virus can accelerate really quickly. And so we've seen it accelerating really fast in that first wave. So we have to be really cautious because it might not take much for another chain of transmission and an escalation to occur. Be it small waves that we clamp down, we really need to suppress those so that, again, it doesn't overwhelm the health system.
The looming threat of a second wave of COVID-19. That was Canada's Chief Public Health Officer, Dr. Theresa Tam, earlier today, warning that another wave of the virus could be on the horizon. And if a second wave does come, this is probably the scariest thing. Canada's long-term care homes may be hit and hit really hard. Remember, a startling large number, over 80% of COVID-19 deaths in Canada are linked to these facilities. And the president and CEO of the Canadian Medical Association told the Senate body yesterday, Canada's not ready, not enough testing, not enough contact tracing, and not enough PPE for frontline workers. So what needs to change to prevent more loss of life? Let's get some insight with Laura Tamblyn-Watts. Now, Laura is the president of the National Seniors Advocacy Group, CanAge, and she joins us now. Hope you and the family are well, Laura. Where are we now? We're months in. Long-term care homes have been hot zones. Have things improved at all in your mind?
Not enough. And, we are cautiously optimistic in some of our provinces and still very worried in others. In fact, what we're most worried about is that people will just sort of say, oh, it's just old people in long-term care. It's okay. We can go about our daily business. But we're still seeing, particularly in Ontario and Quebec, significant loss of life. So it's not as dramatic as it was before, but we're losing people every day.
A lot of the people there, and I know some people who are volunteers, the military has extended their mission in those long-term care homes in those provinces by another month, but they're already going to start to pull back. Who will replace those emergency workers? Is the system ready?
We're not ready. They're onboarding new people. But one of the really critical issues, Evan, is what's the role of the essential family caregiver here? We've had people essentially locked up in long-term care and retirement homes, too, for 2 months now. And many of them are dying of loneliness and social isolation. And so we need to be thinking about how is it that we can safely reintegrate essential family caregiving visits? And that's going to be a question for the second wave as well.
Well, you heard the president and CEO of the Canadian Medical Association say, we're not even ready for the second wave. I spoke to him today, and he was very candid. He said, we are opening too soon. The second wave will come. We're not ready, and it's going to cause deaths. He's very open about that. What does that mean in the context of long-term care homes?
Yeah, we're really worried. There's no question. But I guess it's the question of what is opening? And so when it comes to long-term care homes that don't have any outbreak in them, what can we do to make sure that people have still a reason to live and can get some exercise outside, whether it's an internal courtyard and so on, and can get some of that essential care they need? So we're looking at trying to develop a stepped program which would help to augment the care provision by long-term care homes by people who are really trained caregivers themselves. They are people who have been providing essential care, feeding, eating, and bathing, and they typically are volunteers. How can we get them trained with PPE to support the needed services while also maintaining the spirits and well-being of those in residence? But are we ready as a country or as a province? I don't think we are.
Laura, in Ontario, they've now the government has what they call an independent commission into long-term care homes. I want people to appreciate, an independent commission has different capacities and powers than an independent inquiry. An inquiry can compel witnesses. Though it takes longer, it's more powerful and more independent. Do we need a public inquiry, or are you satisfied with a commission? They're very different things.
So we would like to see an inquiry because I think that there's some hard answers that need to be sought after. A commission is a good step. It's something. The piece that we don't know is, it's a commission and it says it's independent, but is it public? Will all the information be made available in the way that an inquiry would have that transparency? Will the report be made available? So I think an inquiry would be more robust and something that I know that families, seniors, and caregivers would prefer. But if we are only having a commission, will this government commit to making sure that it's transparent and people can participate?
very key issues, and maybe we need a national public inquiry given the number of deaths at long-term care homes. Laura Tamblyn, it's great to have you on the program. I appreciate your insight. Thanks.
Thanks, Evan.